started the timer and here is your question.
Hello, can I start?
Just 35
Oh,
seconds.
1 minute.
You'll be given 1 minute to read the question outside the bay, and after 1 minute, bell will go, and then you'll go inside, and depending
Okay.
upon the station, then you'll be like, if it's history taking, in 6 minutes you would have to complete the history. So just read carefully, and then plan how you'll begin and how you'll go ahead. 10 seconds left.
Okay.
You can discuss the format afterwards.
I cannot see this.
You cannot.
No,
Why?
where is the scenario?
Wait now.
Okay.
So if you have read and understood, kindly begin your history taking station. You'll enter, you'll greet, and you'll wash your hands. Then
Okay. Okay. Good morning. I'm one of the exam candidates. Can I confirm your name and age, please?
Oh, doctor, I'm Sarah. I'm 20 years old, doctor.
Nice to meet you, Sarah. Are you okay if I call you Sarah?
Yeah, sure. Please call me Sarah.
Okay, Sarah. So can you please tell me about what brings you to the hospital today?
Doctor, for the first 6 weeks, actually, I have been in very bad situation. Like some blood is going through my stool, and it is really watery. Doctor.
Oh, I'm really sorry to hear about that. Can you tell me more
Okay.
about it, when it started?
6 weeks back, doctor. I first
Okay.
noticed.
And you've never had this sort of pain before?
No, doctor.
Okay, right. And and how, what's associated with it? Do you have pain with it?
Yeah, doctor. I sometimes actually have pain, like during passing a stool, something like that, and also generally on and off, something like that.
Okay. And so you said you've had this bleeding for 6 weeks. So is it, what color is it? Is it bright
Doctor,
red or is it?
yes, it's kind of bright red, doctor.
Okay. And is it mixed with stools?
Yeah, it is mixed with stool, and the stool is really watery.
Okay. Have you seen any mucus with your stool as well?
No, doctor, I didn't see.
Okay. Right. And have you noticed any changes in your bowel habits recently?
Yeah, doctor, as I've told you, like I am having this diarrhea only, no other changes, and with some
Okay.
blood.
And
Yeah.
do you feel as if you've lost weight?
Yeah, one important thing, doctor, I have lost about 10 pounds during this time. I'm
Okay.
really worried about that. Yeah.
So since how long have you lost this weight?
During this time, doctor, 6 weeks.
During these 6 weeks. Okay.
Yeah.
And okay. And what about loss of appetite? Any tiredness?
Yeah, I feel a little bit tired, and I don't feel like eating anything because, like this type of diarrhea, it is just hampering my day-to-day life.
Okay. Do you have any history of recent travel?
No, doctor.
Any fever?
No.
Okay. Can I ask if you're on any blood thinning medications?
No, doctor, I'm not on any.
And if
Leukemia.
you've ever been diagnosed with any bleeding tendencies, like any abnormalities in your blood tests?
No, doctor.
Okay, that's fine. Can you tell me about your medical problems? Do you have any medical conditions such as high blood pressure, diabetes, or anything?
No, doctor. I hope. I'm 20 years. I don't have any of this.
Okay, and are you on? You might not be on any regular medications. Is that correct?
Yeah, doctor. I am not on any medication. Sometimes I just take paracetamol for this pain.
Okay, and that's it. Okay.
Yeah.
Have you got any allergies?
No, doctor.
Okay. Can I ask if you smoke?
Yeah, doctor, I do smoke occasionally, something like not so frequently, like
Okay.
once or twice in a yeah.
Okay. And do you mind me asking how long have you been smoking for?
4 years, doctor.
Okay. And what about drinking?
That's also occasional, like once in a month, doctors, and it's about 3 years, 3 to 4 years too.
Okay. Right. And do you have any family history of any medical problems, especially related to the bowels or anything like that?
Yeah, doctor, actually, my mom died a few years back for his food pipe cancer. I'm not that much sure, but it was cancer in the food pipe.
Oh, I'm really sorry to hear about that. One thing I
Okay.
forgot to ask you, sorry, do you have any pains or any joint aches at all?
No, doctor. No
Any
joint
problems
pain.
with your vision?
No,
Any back pains?
no, doctor.
Okay, that's fine. And you said you had no your mom, you said she died of. Okay,
Yeah.
that's fine. Is there anything that you think that you would have missed and you would like to add?
No, doctor. This pain, this occasional bleeding, and this diarrhea, that's all. And I have also lost weight, you have asked me. That's all.
Okay. Okay, don't worry about this. I will discuss with my this consultant. We'll probably get the bottom of this for you.
Oh, that's so kind of you, doctor. Thank you so much.
Yes, ice,
Ice, yeah.
ice.
Is there anything you're particularly concerned about?
Yeah, doctor, I'm really scared that my mom got cancer. If that's cancer, can you please tell me? Or it is too early to say that?
Well, right now we need to do some tests, and probably so it's probably too early to think about that. But we'll let you know.
Yeah, doctor, thank you. Thank you so
Okay.
much.
Can you please sum up your case now?
So I have taken a history from this 20-year-old lady who's background, she's fit and well, but she's come in with a 6-week history of bleeding per rectum, a mucus discharge. She denies any extra intestinal manifestations. She says that she's got some constitutional symptoms of weight loss and anorexia. Based on these findings, my main differentials are rectal carcinoma, but I also have to rule out inflammatory bowel disease.
Okay.
And infective gastroenteritis, diverticulitis.
How do you plan to manage her?
So I'll start by doing the blood test first. So I'm going to do a full blood count, UNEs, urine electrolytes. I'm going to do liver function tests, inflammatory markers such as C-reactive protein. And I'm going to do coagulation studies as well. And well, before that, I actually need to do a full abdominal examination, including examination of doing a DRE, digital rectal examination. I'll check the hernial orifices. And after that, the blood test, and then I will probably take a stool sample for fecal occult blood. I need to do an abdominal x-ray as well. And from there, I'll proceed to CT or MRI, determining based on my examination features. And I think she will need the colonoscopy.
Yes.
Yeah.
What treatment would you think be suitable for her?
So her treatment will be based on, it could be conservative or medical or surgical management.
Yes.
Conservative management, I will offer her dietary control advice, such as low residue diet.
Very good.
Medically, so, hello?
Yes, time and all. Just
Okay.
1 minute, last minute, I can give you. Okay, continue, complete please. 1 extra minute I'm giving you.
Hello? Sorry.
Yes. 1 extra minute I gave you. Continue, please, complete.
So, and medically, if I'm thinking about ulcerative colitis, then we'll probably need gastro review. But if I'm thinking about in cancer colon, then she needs to go undergo a colonoscopy. and we then will proceed towards surgical treatment based on an MDT discussion. So she's a multidisciplinary team approach, determining whether it's fit for surgery or not.
Good. Okay, anything else? 10 seconds are left. You want to complete something that you have forgotten in your history taking while you were taking history? Now time is up. Okay.
Yeah.
Now
I think I missed the
yes, you
missed the to ask about hemorrhoids or anal fissures, or
even you missed the pain, because patient was continuously telling you that I have a pain.
oh, I should have asked them more about the
yes,
pain rather than the bleeding.
Site, bleeding as well, and the pain as well. Here you have to cover both. You had to ask about the site and the character of the pain, and then what aggravates, what relieves, because patient did tell you that.
So Socrates, I was thinking about doing the Socrates, but I had that in mind.
And the
but what I
well,
actually thought was that I should, I mean, like I will lose time, so I should maybe focus on the bleeding. But yeah, I should have done the Socrates.
That's why, you know, in history taking, time becomes less. So at the end, when you're summing up, then you say, I would have completed my examination if time would have allowed with whatever has been missed. Then you just mention that, because if you mention it, it is as good as doing it. So in that sense, you just score the marks that, okay, you've covered everything. And now, yeah, you did ask about the history of travel. And then you forgot, and then you asked again about the history, any complaint.
Extraintestinal,
yeah, you did. So you maybe had the differentials in your mind as well. But then my one single request, okay, this patient did give you family history of a close relative dying of cancer. So you made the
should have mentioned it
differential diagnosis, yes, as cancer first, but then you mentioned inflammatory bowel disease as number 2 or 3. So that the least or the milder ones first, and the more severe ones at the end, maybe, unless you can justify yourself. So yeah, if you can just memorize or remember 3 to 4 differential diagnoses for each scenario, and quickly you can just tell them, and then go from milder to the severe ones. So it will.
So not mention cancer colon first.
Why not? Yeah, if you mention first, then they can maybe stop and they can ask you, why do you think it's cancer? Then okay, then you should know why you're mentioning it. Number 1, is 10 pounds in 6 weeks too much to be categorized as carcinoma? This is like my question for you.
10 pounds in 6 weeks.
Yeah, is it too much?
And
one question you didn't ask about the appetite, did you?
I did. I asked appetite and tiredness.
Okay. All right, my bad. I missed. Okay, yeah, but I don't think it's too much.
I mean, it's just like 3 kilograms. So.
Yeah,
it
but
could be intentional. I should have asked if that was intentional, maybe.
Yeah, to rule out more. But then, yeah, time is less. Time is enemy here. So 6 minutes. In 6 minutes, you have to completely take the history, and then in next 2 to 3 minutes, you have to answer the questions.
Yeah, that's true.
Yeah, there are.
So I think it just have to be mechanical practice.
Practice. Like I told them yesterday, each station you have to do at least 30 times. And history taking is the one that in real examination, no one gets to complete it. That's how it happens.
No one gets, what?
Gets to complete it within the given time.
So do you think, Dr. Samir, like the old examination, you know, it's back to normal again. So it's not reading through. Do you think that's probably better? Because so many people said that was more confusing, actually, when they had to just talk through the examinations.
Yes. No, that wasn't. That was easier, rather, because if you know the examination, then you can just walk the examiner through it. You know what you're doing. It's but here, patient can confuse you. Why? Because not everyone, not for you, because you're already in UK and you understand their accent and everything. Just for someone is traveling from somewhere where they're not used to understanding or hearing or talking to someone with the Scottish or that accent, and all of a sudden they come across with a patient who's talking with an accent, and then they might not understand what patient is saying. So it's a disadvantage, here disadvantage is there. But then, yeah, in the other way also, when there were no patient, some examiners couldn't understand some people's typical accent. So there they also faced the disadvantage. They had to give the exam again because the examiner couldn't understand them, and then they had this all COVID things on, and with all these things, when they are talking and they are pronouncing, they couldn't even utter the sentences, or because stress, exam is a stress-free situation. So yeah, but then this way, I think it's more confusing. Sometimes patients would not cooperate. They will deliberately make you irritable, or they will deliberately not cooperate with you. So in that way, examiner would want to see, how you convince them without forcing them and without losing your temper, how you make them follow your instructions. So yeah, it's
Management, patient management.
Yes.
Okay.
So Dr. Abhishek, would you like to give feedback?
No, actually, ma'am, it
was good.
Really a good way. As a patient, I was satisfied too. Yeah. And just saying something in a conventional way, like about the symptoms and everything. We always ask about if there's any existing factor or relieving factor, something like that. And about also like,
I know I had the whole Socrates scenario in mind, and it would probably have been easier. But like Dr.
sometimes they actually put marks in every point, something like that. If you just it, you would not miss any mark actually. And about like who is at home with me, something like this, and also what do I do? This occupational history is also important, I guess, that you have skipped. So just remember the main points that will cover up everything. And about the differentials at this age also, ma'am actually told inflammatory bowel disease is most likely. But as I have given you the history of family history, something like that, you can definitely say the first differential like colorectal cancer. It's okay from my side. I mean, it was really good, and it was like she would definitely get a pass mark from this.
Yeah, definitely. And remember, at the end, you have to finish it with the idea, expectation, and concerns. At the end, these three you should, and if you don't get the time, then at the end, when examiner asks you to sum up the case, then you can say, I would have completed my history taking with the idea, concern, and expectation.
And also one thing at the very beginning, Dr. Raisa, I would like to add something like, if you just gain a gentle permission, like today I'm going to ask a few questions regarding this, the problem you're having, would you allow me to do that? Then it will be also good, I guess. Okay, like you firstly confirm my identity and then just ask me, okay, what makes you to being here today? So you introduced yourself, but then ask about the permission, then you can proceed. Yes. That's suggestion from
Okay, maybe, make it less abrupt.
Yeah, and when you're introducing yourself, there'll be spirit or something. Wash your hands at the same time as well.
Okay, that's fine.
For this COVID situation.
Yeah, because still COVID, it's hanging over us. So especially if there is something, hand disinfectant or something. So use it. Why not? So any question from your side, Dr. Raisa, because this is first time you're...
No, I just think that I need to make a drill of it to practice.
It's better, like I was telling them yesterday, if you can just stand in front of mirror and you can like practice it to yourself, or you can record it in your mobile while you're doing it. So then first time, once you'll hear, you'll pick your mistakes, you'll correct them yourself. Second time, you'll improve. Third time, fourth time, you'll become perfect. And if you can like do like this 30 times, 30, you'll be expert. Then in exam situation, no matter how much stress there is, you won't forget it. You'll remember it, all the steps. So that's my little advice to you. Right, good. Thank you.